Australia is in the grips of a sleep health crisis, with our lack of quality shut-eye now being blamed for some of our most serious health problems, including an explosion in rates of diabetes, heart disease and other chronic illnesses.
And now a leading Melbourne researcher is pleading with the government to step in.
Mr. Sandman, bring me a dream.
We all want more of it, but in a world of hectic schedules, around-the-clock work and screen addiction, getting the right amount of sleep is proving elusive for millions of Aussies.
I'm so alone.
Professor Paul Zimmet is one of the country's leading diabetes researchers.
Fabulous paper you just published.
He's recently published a paper revealing how a lack of sleep is fueling a nationwide health crisis. He found obesity, heart disease, type 2 diabetes, stroke, and even some cancer and arthritis can now be linked back to disruption to our body clocks. It's a condition known as circadian syndrome.
All of these have a relationship to our body clock, our circadian rhythm. I think it's a very common thing, poor sleep, and it's very important the community start to understand some of the factors driving poor sleep.
John Newbold is one of more than 10 million Aussies who battle to get a good night's sleep.
And I'll sleep through till 8:30, so I'm getting plenty of sleep, but it's that quality of sleep is perhaps the issue for me.
The 6-time Sydney to Hobart skipper struggles with sleep apnea and chronic snoring each night. 7 years ago, he was diagnosed with type 2 diabetes and, along with Professor Zimmet, believes his sleep troubles could be to blame.
I notice it myself sometimes where I'll sort of wake with a start, and it's particularly when I'm sailing on the boat that I do get that particularly, because there's no one to wake me up and I wake myself up with it.
A government investigation into Australia's shambolic sleep patterns raised alarm bells that there wasn't any policy or community awareness programs on sleep health. Experts like Professor Zimmet are now demanding the government intervene with a public health campaign.
It just fascinates me that in terms of public education campaigns about healthy lifestyle, that we're not talking about and how we're bashing, actually, our body clocks.
Shift work and overtime is ruining our body clocks, while screen addiction is still seen as one of the biggest barriers to good sleep. Children are particularly at risk on this front. Experts say tablets and phones should be restricted in the 2 hours before bed to limit blue light exposure. But, as John knows, it's not always that easy.
I used to read a lot and that would put you to sleep, but now Netflix doesn't, and I watch Netflix in bed, so that doesn't help.
To improve your sleep, Professor Zimmet recommends a good diet and exercise to boost melatonin levels. Routine is also king. Pick up a book and put down the tablet. It could save your health in the long run.
Good advice there.
Oh, it is. Thank you, Dr. Kosh. But it is, and it's frightening for all of us, isn't it?
I know.